Welcome to Maternal Fetal Medicine. Whether it is your first time with us or we've seen you in a prior pregnancy, we look forward to being part of your care team. We are an outpatient clinic that provides high-risk obstetric consultation to patients and providers on the South Shore. Our staff includes support staff, sonographers, nurses, counselors, and perinatologists, OBGYNs who have specialized training in high-risk pregnancies. Many patients who are not high-risk receive care in our unit as well. This short presentation will help you arrive at your first trimester visit fully informed. After you watch this video, you will decide which type of blood testing you prefer, if any. After making your decision, fill out your prenatal questionnaire associated with your ultrasound appointment in MyChart. We recommend that you call the counseling line in MFM should you have any questions. We also recommend you pay close attention to the portion of this video which focuses on how results are shared with you, as there have been changes in how results are sent. Who should call the counseling line? Any person with a question prior to or following any visit to maternal fetal medicine. Couples who are trying to decide what testing option is best for them. Any person who has a family history of a condition they are concerned may be genetic. We are genetic specialists who care about the health and well-being of the entire family. Before we proceed with the details of the visit and testing options, we will briefly explain common chromosome conditions. These are karyotypes, or pictures of chromosomes. Chromosomes contain your genetic information, or DNA. There are 23 pairs of chromosomes. One chromosome from each pair is from your biological mother, and the other from your biological father. A male has an X and Y chromosome, and a female 2 X chromosomes. The condition that most people are familiar with is Down syndrome, where there is an extra copy of chromosome 21. When there are 3 chromosomes instead of the usual 2, the condition is called a trisomy, meaning 3, like triangle or trimester. Down syndrome is also known as trisomy 21. Children with Down syndrome have some degree of intellectual disability, are more likely to have certain health conditions, and most often live into adulthood. Trisomies can occur with any chromosome. For example, trisomy 13 and trisomy 18. Trisomy 13 occurs when there is an extra copy of chromosome 13, and trisomy 18 when there is an extra copy of chromosome 18. These conditions are among the most serious and are considered life-limiting. The 6 chromosomes, usually either XX female or XY male, may also have an extra or missing chromosome. Disorders of the sex chromosomes are generally not as severe, but may have associated medical, behavioral, and learning issues. Even very small pieces of missing or duplicated chromosome material can impact fetal development. These are called microdeletions or microduplications. These conditions are uncommon, affecting approximately 1 in 250 babies, or less than 0.5%, but are usually significant when they occur. Chromosome abnormalities do not typically run in families and most often occur out of the blue. Now that you have an understanding of chromosomes, let's focus on the details of your upcoming screening visit. The visit begins with an ultrasound. We ask that you fill your bladder by drinking approximately 24 ounces of fluid during the hour before your appointment. Because this ultrasound is performed on your belly, a full bladder allows the sonographer to obtain optimal pictures of your baby. She will document the fetal heart rate, measure the length of the baby, and look at some early structures of the baby's anatomy, including the profile and nasal bone. In addition, she will measure a pocket of fluid behind the baby's neck, called the nuchal translucency. This is the NT measurement. Obtaining all of this information depends on many factors, including the baby's cooperation. Sometimes, due to a baby's position or sleep cycle, not all of the information can be obtained. If this occurs, a provider will chat with you about the next steps. The sonographer is more than happy to guide you through your exam, and you will be provided with pictures. Once the ultrasound is complete, your images will be reviewed by a physician, and you will learn the results of the ultrasound before leaving our department. The second part of screening is an optional blood test. Blood testing in combination with ultrasound increases the detection rate for some chromosome conditions. There are two different blood tests to choose from: early risk assessment, or cell-free DNA, also called non-invasive prenatal testing, NIPT. These tests only require one tube of blood. Early risk assessment involves taking a small sample of the woman's blood, measuring hormones only present during pregnancy, and estimating the chance for a pregnancy to be affected with Down syndrome and trisomy 18. This screening test has a detection rate of approximately 84% for these two conditions. The false positive rate is about 2%. That means 1 out of 50 times we do the test, the results indicate an increased chance when in fact the baby is not affected. Results of this test take approximately 3 to 5 days. All normal results are sent directly to your OB provider's office. If your result shows an increased chance, a counselor will contact you to explain the result and discuss further testing options. Cell-free DNA, or NIPT, is also a simple blood test from the mother's arm. During pregnancy, small fragments of DNA are shed from the placenta into the mother's bloodstream. Because the baby and the placenta develop at the same time, most often the placenta's DNA reflects the baby's DNA. The false positive rate of cell-free DNA is less than 1 in 300. Results for cell-free DNA testing take approximately 7 days once the sample is received in the lab. These are the 17 conditions on the cell-free DNA panel. Trisomy 21, 13, and 18 have the highest degree of detection. Trisomy 16 and 22 are much more rare and are associated with pregnancy loss. The areas marked with small red boxes represent specific microdeletion syndromes. These are quite rare, and detection rates for these conditions vary. The test also looks at the sex chromosomes to screen for sex chromosome variants. You can find out the baby's sex if that is information you'd like to know. If not, we simply ask the lab to withhold that information. However, if there is an abnormality involving the sex chromosomes, the X or Y, the counselor may need to reveal the baby's sex in order to fully explain the condition. In addition to the information already presented regarding cell-free DNA or NIPT, it is important to mention that if a patient has her 18 to 20 week ultrasound and there is an ultrasound finding, very often the level of concern regarding the finding is extremely low if the patient had NIPT and the results are normal. Here is a direct comparison of the two different blood tests, early risk assessment and cell-free DNA. If you are interested in blood screening when you fill out the questionnaire, let us know which blood test you prefer. Please remember, all screening and testing is optional. If you choose NIPT, results will return as either a negative or a positive. A negative result significantly reduces the chance that the pregnancy is affected with one of the conditions on the panel. A positive result indicates the chance is increased. A positive result does not mean that your baby is affected. Normal and abnormal results are available through LabCorp's portal, not MyChart. Directions on how to set up an account will follow. You will be notified by LabCorp when your result is available to you. We also call all abnormal results within 1 to 2 business days after they are complete. If the result is positive for a sex chromosome condition, the sex of the baby is always revealed in the result. If you have any questions, please call the counseling line. You can create an account with LabCorp by first going to their website, labcorp.com. Click on Login, then click on Patient, and finally, click on Create an Account. Fill in all the information requested. When the results of your NIPT test, Maternity 21, are ready, you will receive an email. Please remember that both normal and abnormal results are released through LabCorp's portal. All abnormal results are called within 1 to 2 business days by a counselor in maternal fetal medicine as well. Most insurance companies cover both ERA and cell-free DNA screening for all pregnant women. We partner with a lab that provides prior authorization from the insurance companies and offers a program that limits the cost of cell-free DNA to $299. Your out-of-pocket expense for either test will range from $0 to $299. Some people prefer the most comprehensive testing available, which is a diagnostic test. Diagnostic testing is different from screening. There are 2 common prenatal diagnostic tests: chorionic villus sampling, CVS, and amniocentesis. CVS involves taking a small sample of the placenta between 11 to 13 weeks gestation. Amniocentesis involves taking a small sample of amniotic fluid from around the baby anytime after 15 weeks of pregnancy. Although diagnostic tests provide the most comprehensive information about a baby's chromosomes, these tests carry a small risk of loss to the pregnancy. Both of these tests can provide detailed information about all 23 pairs of chromosomes beyond the detail provided by blood screening. Should you wish to know more about either test, call the counseling line. Please remember, most women will have a normal outcome to their pregnancy. Screening tests allow you to obtain additional information about the baby during pregnancy. Most chromosome abnormalities do not run in families. All screening tests are optional. All pregnant women may choose screening or diagnostic tests regardless of their age or family history. Here are some excellent resources if you want to learn more about some of the conditions mentioned. Our goal is to help you learn about your testing and screening options and to support you through this process. It is our privilege to care for you in maternal fetal medicine.